Well, now we move on. After these important lectures, what we have done is that, as I said in my introduction, that we had the DNB program started in '93, and there are almost now about 100 students who have gone and settled all over the country at different places. And majority or most of them have started doing transplant of their own. And wherever they have settled, they are attached to the transplant center. Our senior most residents, Dr. Rajesh Agrawal, our junior most resident who just passed last year, Dr. Rajnikant Joshi, he also has started transplant. And that is how they get stimulated when they are working here and they start doing transplant. So now we have some of this, they are invited. Basically, these are all, many people are doing it, but these are all few residents and few of our associates, we have called them to share their experiences when they left Muljibhai Patel Hospital after obtaining training in transplant, how they started transplant in their own city, what struggle they had, how they overcome the problem, what is their number, what are their success, and what are. So they will share all their experiences with us today in 5 minutes. So first, may I invite Dr. Muthu, who has been one of our associates of MPUH, who is doing transplant in a very big number in Chennai. In fact, he not only is doing transplant, but he has taught transplant to so many people there in Chennai. Even when he was in MPUH, there were many people who he mentored, and he along with his teammates, along with his juniors, has a huge number of transplant to his credit. So over to you, Dr. Muthu. Please share your experiences.
Am I audible?
Yes, please go ahead.
I'd like to thank MPUH and Madi sir, Dr. Sabnis for this opportunity. I would like to divide my transplant program like in 3 phases. That is before joining MPUH and during MPUH and after MPUH. So before 2005, that is before joining MPUH, I had an opportunity to work with Professor Chinnaswamy, that is after my MBBS graduation, where I was exposed to transplant program. And after that also had during my residency. And my major experience, that's what I had when I was working as an assistant professor of urology in Stanley Medical College, where one of my Professor D. Chandrasekharan was there. He was one of the eminent transplant surgeon, and he inspired me to take a transplant as a specialty. And after that, this is in 2005, I joined as a novice. I have to unlearn a lot of training what I had in the previous institution, and it's a phenomenal experience. The moment I was joined in 2005 November, maybe in the 2006 January onwards, the MRD sir has handed over recipient surgery to me. That was the faith he had on me, and I had a lot of learning, and I had an experience of organ harvesting. About 4 the deceased donor we were doing during that time, and it's a great time at MPUH. A lot of people helped me, and these are the 2 giants. I had an opportunity to work with them. It's an honor for me. MRD sir and MMR sir for their input and critics that transformed him into a transplant surgeon. After coming out of Nadiad, and almost last 10 years, almost May 2011, I came out of Nadiad, and almost I was carrying out around 80 to 90, around 100 transplant in a year, and of which about 70% of them were live transplant, and around 30 to 40% of them were almost like deceased donor program, which was more common in more prevalent in Tamil Nadu. And I had learned little bit of laparoscopy in when I was in MPUH. That inspired me to do like a donor nephrectomy. Almost I have done around 610 laparoscopic donor, and over the period of time, it gave me a confidence to do more on the right laparoscopic donor as a complete laparoscopy. Sometimes we may used to do dissect laparoscopically and make a small incision. and that was our laparoscopic experience. Over the period, there was a lot of we have taken a lot of challenges like double artery, triple artery, double line, and more challenging cases were given opportunity. And there is a desperate donor, no other donor. He had multiple arteries on either side, and he had a retroaortic vein. And you can see laparoscopically we could dissect. There are 4 arteries were there, and we could do a transplant successfully. Almost 80% of the cases, both the donor as well as the recipient was done by me, and over many centers it was done. And some of the challenging cases, they like it's a surgical revascularization of the second transplant, that is we could do successfully. And we had almost an abnormal bladder. One of the problem we had is self-catheterization and UTI. And of course, around 20 pediatric transplant has been done. Almost the youngest boy was 5 years. This patient gathering in a pediatric transplant. And of course, we had some surgical complications like one bowel injury in the early period, and I have to convert one patient. There are 2 readmission. I had 2 patients of chylous ascites, which one was managed by our MPUH protocol conservatively. One patient I have to do a re-laparoscopy to clip the lymphatics, and the patient went home. And surgical complications like we had a wound related. Only one patient had a urinary leak over the last 10 years period, and 1 uretary stricture, and 2 patients lymphocyl required treatment for surgical treatment. The vascular complication, only 1 patient I had a vein thrombosis and a post-anastomotic leak, that is in the post-COVID area, and 3 patients had a renal artery stenosis, which was managed the intervention radiology. And there are 2 aneurysm, one in the cadaver transplant, another in the live transplant. Both had a fungal infection. 2 grafts were lost in the live, and 2 were in the deceased donor. And there are perioperative mortality. There are 1 in live and 2 in the. Thank you so much. I would like to acknowledge MRD sir and MMR sir for this growth. I thank my anesthetists, nephrologists, urology colleagues, transplant coordinators, patients, and staff members. Thank you, Dr. Sabnis.
Thank you, Muthu. That was a wonderful experience you shared with us. It's so nice to see that you have been doing such a variety and with so much of big number. And it is very, very inspiring to not only everybody, but to all of us, that you not only are doing the transplant of your own, but you have really mentored so many people across the country, and especially in the city of Chennai. And they are carrying forward your legacy. I know many people who talk so high about you when we meet them in the conferences. You have really made MPUH really, really very, very proud. So thank you very much for sharing your experiences. Well, next, we wanted to share Vikas Jain to share the experiences. Unfortunately, he's not here with us. He's busy with his close relatives getting admitted because of the COVID. He's held up with the emergency, so he's not able to join. But Vikas Jain is one another our resident who has taken transplant at his career. In fact, he was a resident. That time only he was for transplant. In the residency, he has done 4 transports independently. That was a kind of passion he had. And then subsequently in the practice, he carried forward his transplant passion. He recently completed 1,000 numbers and almost 14 centers, not his center, but he started and helped about 14 centers to develop transplant program. So that made us really very, very proud. So recently when he shared his experience that he has completed 1,000 transplant, we were extremely unfortunately, he's not with us today. He's held up with some emergency. But nevertheless, we would like to put on the record the progress that he has made us really very proud. Well, next I invite Dr. Rasesh Desai. Rasesh, I know from the Sion Hospital days in Mumbai. Subsequently, we worked together in the MPUH. And then after leaving MPUH, he joined Baroda. He was working in the corporate hospital there, Bhailalami. And there he was the instrumental to start transplant program there. And that was really a initial days of starting transplant in Baroda. But he took all that responsibility, get accustomed with the nephrologist. And now it's a regular program where he's doing live related transplant, cadaver transplant. And now it is a well-known center in Baroda for the transplantation. Credit is to Dr. Rasesh Desai. Rasesh, can you share your experiences?
Yeah. Am I visible and audible, sir?
Yes, please go ahead.
Yeah. Respected teachers, colleagues, and friends, I take great pleasure and immense pride in participating in MPUH's journey of more than 3,000 kidney transplants over 40 years. My journey with kidney transplant over 3 decades can be divided into 3 periods. My first exposure to kidney transplants was during my urology residency, and then as lecturer and associate professor in urology at San Hospital, Mumbai from 1988 to 1997. Only live related kidney transplants were done, and that too only one every 3 to 4 months under the guidance of Dr. Bapat, Dr. Sabnis, and Dr. Hase. After Dr. Bapat retired in 1991 and Dr. Sabnis resigned in 1992, Dr. Vatsala Trivedi became HOD and Dr. Vishwanath Billa joined as a DM nephrologist. Gradually, our live-related kidney transplant numbers increased. HOTA was passed in 1994, and with legalization of the brain-dead cadaver, the first cadaver kidney transplant in Maharashtra was done at Sion Hospital in March 1997. Now, I was fortunate to be a team member of this landmark event and was awarded a merit certificate by the Dean for my contribution. Second phase of my transplant journey started when Dr. Bapat sir was instrumental in getting me to join MPUH in 1997 as a full-time consultant urologist. With an already well-established kidney transplant program under the leadership of Dr. Maheshbhai, Snehalbhai, Rajapurkar sir, and Dr. Sabnis, I sharpened my techniques of open donor nephrectomies and recipient transplants. Learned to do transplant Doppler ultrasounds, did graft nephrectomies, managed ureteral leaks, lymphocyl, arterial fungal aneurysms, and stenosis. With 2 to 3 transplants per week, the numbers multiplied, and in 2000, MPUH had completed 1,000 transplants and was celebrated by an awareness program on ESRD and treatment. My third phase started in 2001 as I decided to settle in Vadodara and started my 15-bedded urological and maternity hospital. I joined Bilal Amin General Hospital, known as BAGH, a corporate hospital, as a visiting urologist, and aimed to start a transplant program there. After lots of paperwork and inspections, BAGH got permission to do live-related transplant in March 2005, and it was only the 5th such hospital in Gujarat then. In addition to me, our team consisted of Dr. Jadeja, Dr. Kamlesh Parikh, and Dr. Anil Ganju. The first live-related transplant was done in April 2005, and within first year of permission, 15 transplants were done, boosting our confidence. All were done on Sundays, and I'm grateful to Dr. Sabnis sir, who was our mentor then. To avoid legal issues, a professional detective agency was hired to verify genuineness of donor-recipient relationship. Having a full-fledged trauma center and MICU, and then our next aim was to start a cadaver kidney transplant program. After many public awareness programs, meeting with intensivists and authorization committee, permission for cadaver transplant was given in February 2006. And the first cadaver transplant in Vadodara was done in March 2006. And since that, till date, 20 cadaver kidney transplants have been done. In 2011, the first swab kidney transplantation in private hospital was done, a very gratifying milestone for the transplant team, BAGH and Vadodara. As our confidence grew, boosted by good outcomes, transplants with double arteries, pediatric transplants, ABO incompatible transplants, marginal donors were done, and till date, 200 kidney transplants have been done at BAGH. I rejoined MPUH in 2016 as a senior consultant and now wish to be equally versatile in laparoscopic and robotic platforms and follow MPUH's anthem, enter to learn and exit to serve. Thank you.
Well, Rasesh, thank you. That excellent journey, what you have really mastered. And it is very nice to see that you have done more than 250 transplants in Bilal Amin. And so many firsts to your credit of the first swab, first cadaver, all that in Baroda. So you have established really very well in Baroda, and that was the whole objective, that people from here go outside and serve the country and start the program in their area. Well, next I invite Dr. Jaideep Date, who settled in Pune. He is now attached to Dinanash Mangeshkar Hospital, and he is doing transplant. In fact, he has also started doing the laparoscopic donor long time back as the initial program in the renal transplantation in Pune. And to his credit, there are a lot of transplants now. I invite Jaideep, please go ahead and share your experiences, what problems and what hurdles you faced and how you overcome them.
Thank you, Ravi, and it's a great pleasure to be back in the MPUH family. I joined MPUH as a resident in 1990, and that time MPUH was already in their possibly 200th transplant. They had a dedicated ward, dedicated OTs, which was quite unheard of at that time. They had a UAG Doppler machine in the recovery room where all patients after the transplant used to undergo Doppler ultrasound to make sure that the vascularity is good. They had a residence room in which we used to do sitting rotas right after transplant. So we used to take turn, nephrology resident and urology resident used to stay turn by turn after the transplant for the first 24 hours to make sure that everything was perfect and under the hawk eyes of Dr. Rajapurkar and Dr. Mahesh Desai, and their dedication to the whole program was really inspiring. I still remember that initially we used to do this Khalid butt technique, which Dr. Desai mentioned. And at that time, we had a few complications like hematuria, and a couple of patients we had to do clot evacuation also. And I guess after these couple of complications, we changed over to the classical modified Gregor Leach. And from there, I guess we are now doing modified Gregor Leach. From KM, I went, I'm from Muljibhai, I went to KM for my.
Wrinkle का अभी
Please, others, please.
Please mute.
वहाँ तो 4 बजे तक एक बैठता ही है, उसको और कुछ काम है होता नहीं है, वो मोबाइल लेके बैठता.
Okay, so I joined KM after I left MPUH for my MCH, and it was probably the largest public hospital transplant program in Maharashtra. Probably Sayan used to do a sporadic cases, but in KM, because of Dr. Vidya Acharya, we really had a fantastic transplant program where probably we did something like 20 to 30 cases in a year. I think we had our share of quite a few of surgical complications there, and I was quite confident of managing a lot of surgical complications after I passed out from KM. And I came to Pune in 1994, and at that time Pune had a very infantile program of transplant. Only a couple of hospitals were doing transplants, and I used to go to these hospitals, but the surgeon used to come from Bombay to perform transplant. Initially, Dr. Sham Joshi used to come, Fardun Chunawala used to come, and then Firoz used to come after these two gentlemen stopped. And Firoz was a phenomenal person in a sense that he taught me a lot as far as transplant is concerned, the technique of transplant is concerned. And he is somebody who not only has a meticulous technique, but also has a very calm mentality in a sense that he'll never get disturbed or perturbed by any adverse event that is going on around him. And I think that is one thing that you have to be learning from a lot of these good transplant surgeons, that transplant is a complex operation and something can go wrong, but you have to keep your cool and deal with the situation. I think Firoz taught me that in the initial days. I was also going to Ruby Hall for transplant, and the peculiar situation in Pune is that the transplant program is actually controlled by the nephrologist, and they decide as to who do the recipient, not the surgical team. And in Pune, vascular surgeons, cardiovascular surgeons came and did the vascular anastomosis. And in Ruby Hall also, I used to do the donors and then assist one Dr. Sheshadri, who was a cardiothoracic surgeon. And his technique of anastomosis was one of the most beautiful anastomosis technique that I have ever seen. And I learned huge amount from him to use the right instruments, do the, so respect the vessels. And I used to actually assist him in CABGs. I must have assisted at least 15 to 20 CABGs for Dr. Sheshadri just to learn the vascular technique. And after that, my technique improved, and I think I never had any vascular leaks after I kind of assisted Dr. Sheshadri. We started lab donors way back in 2003 when Dr. Muljibhai had come down to Pune to mentor us to start this laparoscopic program. Initially, our nephrologists were reluctant, but after Muljibhai came and demonstrated and they saw the result, I think they were very happy. And from there, we have not looked back and we have not done open donor nephrectomy after that. There are some recent changes in Pune as far as the transplants are concerned, in a sense that there are transplant surgeons now taking care of transplants at quite a few places where they do liver, kidney, pancreas, everything together as far as the recipient is concerned. And we are, at least in 2 hospitals that I go, I am essentially doing only the donor nephrectomy. But what I've realized is that the success of the transplant actually depends on 3 things. One is having a good kidney that is the good quality of kidney in the donor. Doing the good donor nephrectomy, if you give a good diuresing graft which is perfused well on table, you cool the graft down, what happens on the recipient side is actually very secondary. As long as you don't botch it up, nothing is going to happen to the kidney. But the graft has to be of a good quality. The graft nephrectomy is the main part of the transplant. If you do the graft nephrectomy well, everything else goes well. And I don't think in the last many years we have really seen any ureteral necrosis, any ureteral leak, or such complications occurring because of ischemia of the ureters. Also, another thing that has happened is multi-organ harvesting has come into play, and kidneys are the last to get retrieved. And many times the cardiac surgeon will come in, take away the kidney, then the liver surgeon will get in, take away the liver, and many times you find that the graft which you receive have got torn IVC or short renal vessels and all those problems with the which is actually not acceptable. Like Dr. Pranjal Modi said, I think you need a complete dedicated team to kind of do these retrievals so that the recipients do not suffer. And to manage these damaged vessels to get graft vessels from the cadavers and manage them, it's quite a tricky situation. But that is now, I see the trend in a lot of cases. So I think we have come a long way, and possibly, I don't have the correct count, but possibly around 800 transplants till now. And I can say that overall, the surgical complications have gone down tremendously. The results of transplants have improved. The immunosuppression obviously has improved tremendously. We don't see acute rejections anymore. So post-operatively, if you have decrease in urine output or delayed graft function, you can always be sure that it is not going to be a rejection. It is going to be some other factor like ATN or some AKI toxicity or something like that, but not rejection. I think we have come a long way and we still have a long way to go. Thank you.
Thank you, Jaideep. Nice to hear from you. Now I invite Dr. Rajesh Agrawal. Rajesh Agrawal is one of our senior most probably resident. He was pre-MCH, he joined MPUH, and then subsequently He did MCH from SGPGI, and then he is now settling Jalandhar. I visited his center. I have gone to him 2-3 times, and he's one of our very few alumni who has a huge number to his credit. In fact, along with Muthu and other people, he also has mentored so many people. And in fact, moment you water transplant in North India, especially in Punjab and other places, only Rajesh Agrawal's name comes in mind. So that is a kind of number, kind of volume, and that's the kind of quality work which he is doing. Luckily, he's with us. Rajesh, please share your experiences of transplant journey.
Thank you, sir. Thank you. I'm really honored and I feel very happy to participate in this meeting. And I feel like coming to my home. Transplant. My first encounter with transplant was during my MS. I was doing MS and I was given a seminar on kidney transplantation, urology, and then I transplant also. So that is a different thing. But first live transplant I saw in Muljibhai in 1992 when I used to participate in the donor as a first or second assistant. And when Muljibhai used to start from Ahmedabad, and he will say transplant start kari do. And then we will start the donor, and then he will visit. He will come to the Muljibhai and he will take over and do the rest of the things. Anyway, that was the first experience with transplant, and I remember in 1993 probably the ISOT was conducted in Muljibhai, and at that time I became the member of ISOT also. And then I went to SGPGI, where I was more interested in going towards recipient. Other residents were more interested in going to the donor side, but I was more interested in joining the recipient party. And one day, surprisingly, Mahendra Bhandari, he was the head of department. He told me that you do the transplant. I was taken aback. I never thought that he can tell me to do the transplant. But by grace of God, the transplant was done and successfully, and I felt very happy that day. So, and then that was the first transplant under the supervision of great professor like Mahendra Bhandari. Then first independent transplant was in 1996 when I got a call from Ranchi to do a transplant in a new hospital. And at that time I was planning to settle in Ranchi because Ranchi was my hometown at that time. So I thought I should not miss this opportunity. I went there, and that was a totally new hospital. The instruments were very crude and there was no assistant who saw any transplant. The first main assistant was the nephrologist, you can imagine. And in those circumstances, I did that transplant. Luckily, it was successful. But at the time of when I was removing the clamp, the Satansky was entangled with the vein, and there was a large tear in the renal vein. And I was really very much frustrated of how to manage that. That was my first independent transplant. But then I put my finger on the and gradually started repairing from one side because kidney was already vascularized. I didn't have courage to clamp it again and flush it again. So while the kidney was perfused, I slowly repaired the vein, and that went off successfully. And that is my longest surviving transplant also. It is almost 25 years now, and that patient is still surviving. The mother was donor, and he is doing fine. So after the MCH, I came to, I joined a private hospital in Jalandhar, and there I started the transplant, and gradually we started doing transplant more and more frequently. And when I left that hospital and started my own center, then I started visiting other places also. And I think I started kidney transplant program in about 15 hospitals, in 15 different hospitals in different cities in India and abroad also. In 3 countries outside India, I also have done transplantation. And my most satisfying day was when I did 5 kidney transplant in a day along with 5 donor nephrectomy. And that was not in India, outside. And suddenly I had to prepone my departure from that country. So I had to do all those transplants in one day. And by the end of the 5th transplant, I was totally exhausted. And my flight was only 3 hours later. So I remember that was but I was very satisfied because all 5 went successfully and there was no significant complication in any one of them. So far, I have done about 1500 transplants. And the youngest patient was 5 years old. And I remember that transplant I did in Nigeria. And the biggest problem with me was how to put the kidney in the abdomen. There was no place. It was a real challenge to put the large adult size kidney in a 5-year-old child. But then it was done and the child was is doing fine. And then regarding complications, I remember 2 donors. There was slippage of clip in the renal artery in 2 donors. One donor was from Ladakh and he was having hemoglobin of 17, and I got the call from post-operative ward that there is sudden fall in blood pressure. I rushed to the ward. I saw that there is nothing, no drain was blocked and there was nothing was coming in the drain, but the abdomen was tense. I immediately shifted the donor into the theater, and without anesthesia in supine position, I opened the abdomen. I put my hand into the renal bed. I clamped the artery. While the donor was shifted to the OT, the drain bag was full of blood. And you can imagine from 17 hemoglobin, his hemoglobin came down to 5. But he survived, and that was really very satisfying. Another slippage of clip only 2 years back was in Ludhiana in one hospital. That was the first transplant of that hospital. And there was sudden fall in blood pressure. Immediately I rushed. We were taking breakfast after the transplant, and we left the breakfast, rushed to the theater, took the patient, and again, since anesthetist was there, he immediately anesthetized and we could control the bleeder, and that lady survived. So these 2 were horrifying complications, but luckily both were managed successfully. And there was one recipient who had post-operative sudden renal artery thrombosis. And what happened that during reversal, there was sudden hypotension, and probably that led to the thrombosis of renal artery. That patient was immediately shifted from recovery to theater. I opened the flush, I flushed the renal artery and re-anastomosed, and that graft started working after 3-4 days. There was initial ATN for 3-4 days, and then it started working. Another complication I remember when doing laparoscopy in initial days, I injured one spleen and I was not able to control the bleeding from the spleen, and ultimately I ended up doing splenectomy. So these are the major complications, but so far there was touchwood, there was no intraoperative or perioperative, immediate perioperative mortality in donor recipient. So this is my journey about transplant in short, and I think the great interest which I developed in transplant was from the days when I joined Muljibhai, and especially when we had ISOT in Muljibhai. At that time, I developed the transplant interest in transplant, and I want to continue this interest future. Thank you.
Thank you, Rajesh. It was really fascinating to hear a lot of experiences from you. You have been very nice to see that you have trained so many people. You have started so many centers, not only in India, but in abroad. I think you are in the car probably going somewhere to do transplant, it seems.
Yeah, I'm going to, I'm going to airport. I have to catch the flight. So
or doing transplant somewhere. So wish you all the best. Nice to hear from you. Now,
thank you.
So now I invite the next Dr. Lokesh Sinha. Lokesh, after passing from here, he joined the Mumbai with Dr. Pradeep Rao, and over last few years of the hospital development, he has mastered the technique of transplantation, and now he's a very, very active member. He's doing all sorts of transplant, and as PP told you, that the global hospital is the number one hospital doing in private doing transplantations.
So, and Lokesh is actively involved in all those transplant which that team is doing. So Lokesh, please share your experiences, how you evolved as a transplant surgeon, how you got recognition, and everything what you have experienced in the last few years. Over to you, Lokesh. Please unmute.
Now I'm
Lokesh?
audible, sir?
Yeah, please. Go ahead.
Please. Yeah, good afternoon, sir, and good afternoon, everyone. I just will share. Yeah, it's seen, sir?
Yes, it is seen.
Yes, it is seen. Okay. So, one second, sir. Yeah, good afternoon, everyone. My transplant, like everyone who have presented, I had also some interest in transplant, and it started in MPUH, where I saw first time transplant. So in residency, the first year surgery, the most exciting surgery we used to get was preparing bed, and it was the first time we were so much close to the vessels. So it was an exciting thing. Then I did my first transplant in the final year of residency under guidance and supervision of Sabnis sir. And then during early days of my consultancy for like next 10 months, I did around 4 to 5 transplant independently under supervision of Sabnis sir or Jigis bhai. Then I joined Dr. Pradeep Rao in the private practice in 2013. I can say for doing a successful transplant program or any major surgeries, you require a good team. And at present, we are doing transplant as a team in Global Hospital, Parel, Jupiter Hospital, Thane, Reliance Foundation Hospital, South Bombay. And recently, we have joined in the MGM Hospital, Navi Mumbai, Vashi for the cadaveric transplant. I did my first transplant recipient independently. Before that, in 2015 October, before that we were doing only donors, and the recipient was done by the other surgeon. So first recipient was done in 2015 October when the surgeon was out of town, and it was a little bit challenge. It was a cadaveric transplant, second transplant, obese lady, and severely atherosclerotic vessels. But I remember Dr. Pradeep was continuously throughout the surgery was in the operation theater, helping, guiding, and motivating me. And it went off well. The patient was discharged with normal creatinine, and then the journey for the recipient surgery started. So, as I told, as a team, we started doing both donor and recipient since 2015 October. And since then, we have done 582 total transplants with 491 live, 91 cadavers. We have done robotic recipient in 14 cases, with one of them being a cadaveric transplant. We have done combined liver and kidney transplant in a 5, and one being a live, where wife was the liver donor and the daughter was the kidney donor. We have done one combined pancreas and kidney transplant. We have done dual transplants, all adult donor and adult recipient with marginal donors. One auto transplant. We have done 8 pediatric transplants, smallest kid being 10 kg, where we have to keep and it was also our first pediatric transplant. We have to keep it in intraperitoneally and anastomose to the aorta. And 2 cadaveric pediatric transplant. One cadaveric transplant had a donor of 2 years and a recipient of 7 years. And till now we have done swab transplant of 5 pairs. I will discuss some of the early cases and special cases which had given us lots of experience and helped us in developing our skills. Dual transplant, as I've told, all our dual transplant are adult donors in a cadaveric transplant. So because of the size of kidney, I prefer to do on the both side, both iliac fossa one by one. So I first do right iliac fossa transplant, leave the ureter unanastomosed, then do the left iliac fossa, and then do the ureter anastomosis on the both side. Till now we have done, as I told, around 6 of the dual transplant. One advice I will like to say in the adult dual transplant is avoid of our obese recipients, especially more BMI more than 33, 34, because it's a very challenging and very difficult to do. And we have faced in one case that thing, which the surgery lasted for almost 14 hours. One thing which Dr. Pradeep Rao has started doing, and we are doing quite number of cases, is doing simultaneous ADPKD right side nephrectomy along with the transplant. So Dr. Pradeep or me or Dr. Jagtap does the nephrectomy part first, then make the patient supine, keep the ureter attached of the kidney, then keep the incision same way, do a controlled opening of the peritoneum, and then remove that, retrieve that kidney, cut the ureter, and then proceed for the transplant. This case, which I have, like someone of you must be knowing, this is the most challenging transplant I have done in my career. Is a pediatric transplant who was a 7-year-old boy with 14 kg weight. He had a PUVAL fulguration done in the past with bilateral sober ureterostomy and a small thimble bladder. So we have planned for a bilateral nephrectomy from the midline incision, transplant on the right iliac fossa, and then cross over the ureter from right to left and anastomose it to the native distal end of the left ureterostomy. So this is the picture here. Because of the size of kidney, we were not able to close the sheath. We have only closed the skin. But after long surgery, it went off well. The patient was discharged with 0.5 creatinine, and it's good and challenging case. One, we have done auto transplant. It was done in the patient of a severe inflammatory aortic aneurysm with opposite kidney non-functioning stented, has a left side renal arterial and origin stenosis with creatinine of 4. The cardiologist have advised to put a stent to prevent the rupture of this aortic aneurysm. And for that, we have to do first auto transplant. So because that renal artery would have been blocked by that stent. So Dr. Pradeep did a difficult donor nephrectomy with lots of inflammation around the aorta. In that, we have, before that donor nephrectomy start, we have kept the incision in left iliac fossa in the supine position, dissected the vessels, then gave the position for the kidney, retrieved the kidney from the same incision, kept the ureter intact. After flushing and keeping the kidney in the cold, we again make the patient supine and did the anastomosis of the renal artery and renal vein to the external iliac artery vein. And we have kept the kidney upside down so that the ureter remains attached and is not getting tortuous. And in the end, I will like to say thank you. And I will say, for a transplant, you require a good team. And with God's grace and everything, we have a very good team consisting of a mentor and a colleague like Dr. Pradeep and a friend and colleague like Jagtap. Thank you.
Thank you, Lokesh. I think it was wonderful.
Thank you, Lokesh. I think it was wonderful
that in your residency days how your residency days has been transplant surgeon. So well, now I invite next is Dr. Who is next? Dr. Vikas Agrawal.
Yes, sir.
Vikas Agrawal is another. We are very, very happy that Vikas Agrawal is joined. He has done huge number of transplant. He's settled in Delhi, and at so many centers he has started doing transplant. In fact, of late he has done so many complicated transplants. Number of multiple vessels, pediatric, high BMI, foreign national, so many things to his credit. So Vikas, we are extremely happy when we read that you have done so many complicated transplant. We feel really very happy and feel very, very proud about you. So please share your experiences, how you started your journey and what have you come so far.
Thank you very much, sir. And it is my great privilege to be among the stalwarts and my MPUH alumni. I think I'm audible and my slides are visible, sir.
Yes, yes, please go ahead.
So in MPUH, I was in resident from 2010 to 2013. Whenever I see this slide, and I feel very proud to see that I am in one of the MPUH alumni. Down the line, so many seniors and teachers are above me to guide. So it's very good privilege for me. And my teachers and mentor, Dr. Muljibhai Patel sir, everybody knows he's a great visionary. And Sabni sir, always helpful and always helping us, teaching everything. Muthu sir give us the small tip about the fistula formation and the vascular anastomosis. Dr. Ganpule, I always remember whenever he used to do lap donor, before the transplant, he used to call before evening to the donor, do the ultrasound, see all the reports personally, and he take meticulously everything so that donor does not feel any complication. So it was a great, whenever we do, so we always remember the principle. Rajapurkar sir, we always remember initially in a frightened matter, whenever we go to the Wednesday transplant meeting at Nadiad. So it was really shocking that sir is sitting in front and we will ask so many questions. But later on, once we start doing the transplant, we always admire that sir has taught us so many small things and never neglected even a small vomiting, small episode of fever, and small drop of the hemoglobin. It is very important whenever you're doing the transplant, you look each and every aspect. And Shishir Garsang and Hegde sir was always helpful. And I will also like to gratitude to all sister staff at Nadiad, and especially Deepti sister, and who was always helping us when we were the resident and all our patients. So my journey starts when I joined back in Delhi at Max Shalimar Bagh. I asked sir to give the certificate so that I can apply for transplant. So sir gave me this certificate by 371 kidney transplant performed during my residency. And then this was the motivation to start. And now I have done almost 388 independent kidney transplant after leaving the Nadiad. So initially I joined the Max Hospital. Dr. Atul Goswami used to come to Nadiad and he called me, let us make a team and do the transplant. So I did start the Max Hospital Shalimar Bagh. And that initial time we start for the transplant program permission. It requires a lot of efforts when you start in a corporate hospital or in a initial start. So everything you have to do, the transplant coordinator, transplant setup, dialysis, everything. So I was lucky to start that program. And but meantime, we were getting the transplant permission. We will get proficiency in getting the laparoscopy urology, because that was my main concern initially when I started. So doing all laparoscopy, partial nephrectomy, radical cystectomy, and everything radical prostatectomy, which we learned at the Nadiad. So I could do that time. So in the 2015, we got the permission, and I was lucky to have Dr. Wahid Jaman. He came from Apollo Dhaka, and he was my senior, my colleague, who taught me each and everything about not only about the surgical skill, but also the mannerism you have to develop the transplant program, the team efforts, everything. He has given me that opportunity. And initially in the first year, we did the 28 cases, including all initial challenges, including the avian compatible and deceased donor, which was very difficult in happening into the north part of the India. And we, from the very first, we start the lab donor. And I would like to mention Dr. Ganpule, for some reason, visited a few days before when we planning for first lab donor nephrectomy at our institute, and he gave me the confidence, because you start initially the first case with a lab and you will do it. So I thank to Dr. Ganpule sir, and he gave me the courage, and from that time I have never done any open surgery for the lab donor, and we are touchwood successful in doing all kind of double vessels and the right side in the first year. So in the first year, when I got this much confidence, I went to the WC 2016, because from the Nadiad, we have always been keen that we present whatever we are doing so that we can learn many things. So WC 2016, I've been lucky, and all Kazan and Mahid Desai sir and everybody was there to admire that point of technique which I dissected in the hilum dissection and present in the WC Cape Town. So then because initial time we could do the cadaver transplant, so we did so many activity among the school, the colleges about the organ donation, and that resulted that we were recognized for deceased donor program in second year. We did 8 kidney transplant in a year with the deceased donor, and this was the youngest 17-year-old boy whose father came forward and donated all the organs, and from heart to and everything kidney. And I would like to mention the last kidney transplant of cadaveric, which I did at Max, was of my own batchmate, which is in the next photograph. And she was my MBBS batchmate. Initially, she went first transplant live related, but now she was again on the dialysis dependent after 20 years. So I could do the deceased donor transplant of my own batchmate. And so that was another, I feel, good thing about the transplant. But slowly our management issues started, nephrologists become resistant, and the program started declining. So that time in 2017, we talked with Dr. Vikas Jain, and we made a group of 3 or 4 urologists, and we took out the 3 hospitals in Delhi NCR by the VPS Rockland name. But unfortunately, Dr. Vikas could not join. But finally, he gave us the guidance, and we did make a good team of the urologists and do the 22 cases in a year in the new hospital, starting from the scratch in many senses. But we had a nightmare experience with grapholone injection, which was immunosuppression that time given. But finally, again, this management, the VPS group, which was attached from Dubai, has started declining, and our teams of the nephrology initially moved. So I got a chance that I could help my colleague also. Rajiv Sarpal was in Himalaya, and Shabaz, my nephrologist, during my time in the Nadiad was together, and they called me for help in the Himalayan Institute. So I could mentor 12 cases in that case in that Himalayan Institute, and that was a beautiful time. And Then in 2018, I joined a reputed institute like Asian Institute, where the nephrologist was from Medicity moved with me. And we did 132 cases in a 2 year, including all challenges, multiple vessels, obese recipient, retransplants, ABM compatible, and the swab kidney transplant. This time also we thought that we will start the disease program, but we were in the process that we will continue with that. And this was the very challenges journey. And touch wood, my two colleagues with the urology with me and the nephrologist, the Ritesh and the BK was with me, and we could do good on number of the domestic cases. Initially, it was all the outsourced cases, but we could develop the benchmark into the Faridabad that we are the maximum number of the transplant are doing at the Asian hospital. So this time I presented my first of injury. This occurred during the right lap donor nephrectomy, which was IVC injury. And that again, I managed with laparoscopic. So I did not convert it, and I could courage to do the IVC injury repair with the laparoscopy, and for which I was awarded a prize at DUSCON, the National Conference of Delhi Urological Society. And then I presented, because many patients that time have done with double vessels. Previously I have done, but triple vessels and the 4 vessel. This was new when I joined at Asian. So I could present this in the CAST conference with the 2019, which happened in Delhi. So I present the different technique of doing the re-anastomosis by the triple vessel, either pajama technique or by the anastomosis to the end to side to the main artery, and the separate anastomosis to the inferior epigastric artery. So I could manage the 4 renal vessel up to, and again with the laparoscopy technique, we retrieve the donor and do the transplant. So all touchwood with all the guidance, it became successful. And one complication we had, because right side donor, we used to staple the renal vein with the stapler. And that time there was fault into the stapler, and we could not open the stapler. So it fired, but it could not be opened. But luckily, we managed with laparoscopic Satensky clamp, and we came out. And this problem I discussed in the Urology Comcon 2019 and was well appreciated. And now 2019, before the COVID started in the 2020, so my previous team of the nephrology, which was as Rockland, called me again, let us start at Akash Healthcare with new beginning, with new everything, because the Faridabad was very far from my house. I live in Gurgaon. So then I shifted to Akash Healthcare Dwarka, which is again a new hospital, and we started the transplant. And we have the good nephrology team of the 3 nephrologists. Separate is our pediatric nephrologist with us. So we have good number of the people, urology, nephrology. Right now we are doing 4 to 5 kidney transplant per month. And international OPD we used to do regularly, and we are getting many of the international patients, and we are especially focusing on the pediatric nephrology department also. So in the transplant, again, we continued in the COVID time, initially with the HICHEC, and then again we have to start. This was international patient, and he post-transplant developed the COVID. And it was really a tough time. I discussed with my senior, myself, Sabni sir even also. So, but luckily with 30 days into the ICU with non-invasive ventilator, he came out. He was a young patient. And that was a victory of all our ICU team and the transplant team, that we could survive in the COVID time also. This was a difficult time, but finally this patient survived and went back to his country very well. So again, doing the transplant gives the confidence that we can do some difficult kind of the cases. This was the patient who had upper ureter completely lost, and he was tried outside a reputed hospital for the bowel interposition, but due to the dense adhesion, they could not reach to the hilum. So finally, we did the laparoscopic nephrectomy in this patient. There was massive adhesion at the hilum, and we did the auto transplant into the left leg fossa. This patient was from Bihar, and he came last month only, and he is doing absolutely fine. So it gives again, thanks to Nadiad, who give us the courage to do this kind of the challenges cases, and we took up these cases, and this we could save the life or the kidney of this kind of the patient. So last week only we did the multi-organ retrieval, which was again after 4 years, because in Delhi there is so much negativity among and it's very difficult to convince the patient. So this patient again 57 year in house in our ICU, and family after consenting, give the 2 kidney and the liver and the eyes. So we could transplant 1 kidney, and we transfer the another organ with another hospital. And this again at 4:30 a.m. all the team was enthusiastic and took a photograph. So this gives really heart feeling happiness whenever you do this kind of the brain dead patients transplant, besides the liability transplants. And this case we have done on the Tuesday, the 7-year-old boy who was having posterior urethral valve and both kidney was damaged. So we did the transplant, and again with the grandmother, adult kidney. By seeing the Dr. Lokesh slide previously week, yes. So I was little bit scared, but finally everything goes well. Extraperitoneally, we could anastomose to the common iliac artery and the vein, and right now the patient is doing absolutely fine. and thanks for all the guidance. So now I would like to thanks and regards to all my teachers, colleagues, and of course the patients, and special thanks to MPH AMA. And still there is long way to go. This is my just starting journey of 8-year post Nadiad. So with all the wishes from Sabni sir and everybody's, my sir and everybody, nephrology, urology, and my colleague, full MPS sports and all of my seniors and juniors. So we will be able to reach further heights. Thank you very much, sir.
Thank you, Vikas. It was so nice to hear from you. So much of complicated cases, so many places you have changed, so many centers you have started, so many colleagues you have taken along with you, and so many places where you have done this transplant. It was really courageous, and we really admire that. You have really made us very, very proud, and very nice to see your journey. Wish you all the best. Well, next I invite Dr. Rajan Sharma. Rajan Sharma, again, he settled in Chandigarh, and he also was quite passionate about the transplant right from the days when he was in MPUH. He continued his interest. In fact, he joined with Dr. Anshuman Kapoor, one of our alumni, one of our students. They are all doing endourology and various other cases. But because of this transplant, the passion, he joined one another institute, and there he started doing transplant. Recently, he did his pediatric transplant, and I saw the photograph with that child. It was really wonderful. It was really, really nice to see that. And Rajan, can you share your experiences, how you continued your passion, how you had the struggle in between, how you overcome your problem? Please share some of your experiences with us.
Yes, sir. Good afternoon, sir. Am I audible, sir?
Yes, yes, please go ahead.
First, I would like to thank MRD sir and Sabni sir for including my name in all these stalwarts. Actually, I am an infant in this transplant journey, but I started my journey 10 years back, and I could culminate it only recently, few months back. And it was a long, arduous journey. Like Sabni sir said, it was always a passion. It was a long cherished dream. But I took almost 10 years to, come to culmination of that dream. So I left Nadiad in 2011. So the first step was establishing myself as a urologist in the private sector and identifying a hospital where I could start the transplant program. Then I identified one hospital, which was a 150 bedded hospital. So it took me 3-4 years to convince them to start a transplant program. The management was not very cooperative and not willing. So I prepared the entire application, the entire file myself. I invited the inspection team myself. I took everything on my head, but the management was not with me. So I had to give up that hospital. And then 17, I joined another hospital to pursue the transplant dream. In all this entire journey, there were two people who were really important, who were in my corner, who kept me going on. And that was Sabni sir and Dr. Vikas Jain. Without their strong emotional, surgical, and moral support, actually, I would have given up long back. Then when I joined the second hospital, we did the inspection. We got the license for 5 years. That was in 2018, December. We worked up the first patient for the transplant. Unfortunately, our nephrologist suddenly left for better pastures, for a better pay package. And we requested a lot to that nephrologist that let our transplant program kick up. You may leave after the first transplant, but he didn't relent. He left. So again, we were in a soup. Our transplant program was already, again, not taking off. So then we looked for another nephrologist. It took us time looking for another nephrologist. In Punjab, there is a very difficult rule that even if one member of the team is changed, they will do a re-inspection. In fact, we thought that it will be only the credentials of the new nephrologist which will be taken into account. And we had already gotten a license of 5 years. But in 2019 end, we got the new nephrologist. We submitted our papers again. The new inspection team which came, they were slightly biased. They somehow rejected the entire transplant center for very frivolous reasons, which we found out someone was playing foul in our hospital only. So then we fought again. We requested for a re-inspection. And unfortunately, that time COVID started. So none of the government officers were ready to come for an inspection. So it took us entire 7-8 months. Then in July, August, when COVID peak had started coming down, we requested a re-inspection, got a re-inspection done. And September 2020, we got the license re-initiated. And in all these times, I was continuously talking to Sabnis sir, and I was continuously talking to Vikas Jain, who kept on telling me, don't worry, everything will be fine. We are there with you. And then 3rd January, I did my first transplant. And because of strong surgical support from Vikas Jain, our first patient was a pediatric patient. He was a 14-year-old boy, 30 kg boy. And Vikas gave us the confidence that we could take the first patient as a pediatric patient. And in the last 3 months, I have done 5 transplants, though a very small number. But my journey somehow has started. And in these 5 patients, we have done 1 marginal donor and 1 double vessel transplant. All 5 are doing well. All donors have been done by me. All have been done laparoscopically. And I have been mentored by Dr. Vikas Jain very thoroughly. And not to mention, during the setup, Lokesh also helped up a lot. When I was setting up the OT, I kept on calling him up on phone to inquire about the instruments, which instrument to take, what will be the size, everything, including the needle drivers, the clamps, everything. And because of these people, Sabnis sir, Vikas Jain, I've been able to achieve my dream. And my journey has just started, but I am determined to keep going and keep pursuing my dream. Thank you, sir.
Well, thank you, Rajan. I think your journey is really most inspiring, because I think you have set an example not only to us, but for the others also who are watching, that in transplant, what is more important is never give up. And all throughout, even though you had so many problems, people kept on going away, licenses were cancelled and things like that, but you never kept on, you kept on going. You never stopped at one place. And obviously, the result is obvious that now you are in a transplant program. I'm sure more and more patients will get attracted. I am quite confident that you have the necessary skill, you have that necessary background, and I'm sure your program certainly will take off very well. And it is just a matter of time that your numbers also will swell remarkably. So thank you very much, Rajan. I think a lot of these people, they are all actually token samples from the alumni people, they have done it. There are many more people who are doing transplant in their own areas, but we just selected few, and with the want of time, we could not invite everybody. But I think they have shared their experiences, and everything is common in them, that they had the passion to start transplant. And our idea was that when they come here as a resident, our idea was to stimulate them. Once they get stimulated, the passion develops, the liking develops, necessary skill develops, and then that is how they go outside and start doing transplant, and then the program keeps expanding. It is not only one center who keeps doing more and more in numbers, but if you mentor all these people and they go out and they keep doing number, I think that number is going to become extremely big. And that gives actually more satisfaction to all of us in MPUH. If we achieve number from 500 to 1,000 to 2,000 to 3,000, yes, it is all right. But collectively, when it becomes 10,000 and 20,000 and 20,000 becomes 50,000, I think that gives more and more credit to MPUH. And there we feel really satisfied. And looking at all your journeys, all 7 people who have really shared your experiences, we really feel satisfied. At the end of 40 years of our transplant journey, if you can achieve and if you can train all these people, and they have done such a remarkable job at different places, I think there is no other satisfaction than sharing the experiences of your marvelous journey. So once again, thank you all of you for joining this particular session. Although we are extremely late,